Hello, Dr. Pirie, Dr. Patel, thank you for joining me this morning. Audience, I'm Dave Wattel, 30-year licensed lawyer, founder of National Health Finance, part and parcel of law finance. Thank you, gentlemen, for joining me today.
Great.
I'm going to talk about National Health Finance, about medical referrals, about psychological care, talk about dealings with online and/or telemedicine in this COVID world. So again, thank you, gentlemen. First and foremost, Dr. Pirie, why don't you give us a quick background on you, and then we'll go to you, Dr. Patel, and ask the same.
Sure. Good to see you guys. I graduated from the National University of Health Sciences in 1999, so a little bit over 20 years experience now. Probably entered the personal injury work comp landscape a little bit heavier in the last 10 to 12 years, and have been working with NHF as a funder for close to 5 years now. So that's a little bit of story on where I'm at now.
Dr. Patel?
Yeah, thanks for having me on, guys. Pleasure to be here. So my undergrad background is from the University of Michigan in economics. And after that, I went to medical school, went through anesthesiology residency here at Rush University in Chicago, and then went on to Cleveland Clinic to do a chronic pain fellowship. Over the last 6 or 7 years, I've been in private practice in the Chicagoland area, doing mostly interventional spine, chronic pain treatments. Through the chronic pain world, psychology has been a big part of my practice. So we've been doing things for our own patients, and that's kind of how we got into all of this on the personal injury side.
So gentlemen, first and foremost, how do you play a role with your practices in national health finance and specifically psychological or neuropsychological care? Dr. Pirie?
Well, I think for us as chiropractors in my clinics now, we've got multiple locations, same thing around Chicagoland. We end up being an intake, so we're seeing a lot of these initial exams, people that don't know where to go or certain types of referrals come in, and we know we're examining them head to toe. One of the things that we've developed that I think we're pretty strong at is identifying soft tissue and hard tissue components. But historically, we've had difficulty with nausea, dizziness, headaches, irritability, lack of sleep, things like that are just that buzzword concussion. So the person had a CT, a lot of times at the ER, but they're left untreated. So with this new modality available, it's something that we can offer our patients now where I think, it just gets it out of our hands and gets it to the right provider, and the patients are really, getting great outcomes and appreciating that service that we've added.
And Dr. Patel, your company, Cogent, explain how that interplays with Dr. Pirie and National Finance.
Sure. So the service we provide is a comprehensive psychological and neurocognitive evaluation. So there are two parts. First part being the comprehensive psychological evaluation, which we use to tease out things like anxiety disorder, adjustment disorder, post-traumatic stress, things you can't find on an imaging scan. And then the second part of it is a neurocognitive evaluation, which everybody is kind of more probably familiar with concussions and things being such a hot button topic. We assess for cognitive issues, linguistic issues, personality changes, executive functioning issues. So if you go back to the first part, the psychological evaluation, like I was saying, can't be diagnosed with imaging, right? You can't see post-traumatic stress. It takes a psychologist to tease that out, along with assessment tools that have been verified and studied in order to kind of grade all of these things. I mentioned post-concussive syndrome just now. That's exactly what it is. It's a syndrome, right? A syndrome is a constellation of symptoms as related to specific pathology. So by definition, it can't be seen. There's no imaging findings. The symptoms have to be teased out through the assessments, through the evaluation, and it's very easy to overlook. Mental health issues are the most underreported kind of issue because you can't see them. But if someone has a leg injury, you don't wait to see what happened. Right? You get an x-ray, you get a diagnosis, so you can start treating. And that's basically what we aim to do with our services. Get that diagnosis quickly so we can get the patients into treatment.
And so, Dr. Pirie, you're front line in terms of treating patients subsequent to auto accidents. How do you recognize, and also could you give a word or two to other providers as well as attorneys? How should they recognize when to involve a psychologist or neuropsychologist?
It's very important that the chiropractors or physical therapists or even nurse practitioners, that we have in our office or at many of these offices operate the same way, are asking the proper questions. Like Dr. Patel just said, and I said previously, some headaches, dizziness, irritability, it could be lack of sleep. And I think the big thing is that not waiting. So the old approach used to be, let's fix the whiplash, let's fix the back pain, let's fix the, whether it's through injections or physical therapy, and let's see what happens if the headaches are resolved. It was a wait and see approach, which I think is incorrect. So one of the things that we really look for is to identify these things, and if they don't progress or if they don't, improve, the next step is getting them to someplace like Cogent, because I really believe that for most providers, especially a provider like me that's 20 plus years in practice, it needs to be out of your hands. You need to have the specialist take a look at it, not only for the case, but for the patient. So it's something that's available. That's simply, I think it's not that many symptoms that you need. Brain injuries, like Dr. Patel said, I think are much more common than a lot of providers account for. And I think with the CTs, a lot of times if there's no intracranial hemorrhage or something that really shows up, it's sort of a wait and see approach, which I've come to believe is wrong.
And Dr. Patel, a patient that's referred into Cogent, first of all, Cogent provides a telemedicine platform, my understanding, to patients across the country. So how does that work? And then once a patient is referred in, what takes place?
Sure, Dave. So our goal has always been to remove as many barriers to care as possible. A patient who is less burdened by care is always more compliant, and the outcomes are just better. So the thought process was, of course, if you're going to see a spine surgeon, most likely you want to see that person in the office. They need to put hands on you. They need to do some tests. Psychology doesn't work that way, of course. So if there's no need to drag a patient across town or across the state to have an evaluation, they should be able to do it from home. And that's what inspired the telemedicine component for it. So when a patient gets referred to us, basically there's a few steps. We send out all the information that the patient would normally fill out or go through in the office of the doctor that they're going to see. Standard intake, things like that. They can all be typed up, sent in directly through email. Then we send them an assessment. That assessment it's a short multiple choice exam that gives us an objective score on certain things: anxiety, stress, post-traumatic stress, all that kind of stuff to help the patient and the psychologist come to a good diagnosis. Once that's done, there's about a 45 to 60-minute appointment, again, through telemedicine from the patient's home, location of their choosing. Once that's done, the patient, if they need further treatment, the psychologist will recommend that and go ahead and schedule that if possible. If not, they'll reach back out to the attorney to see if that's something they're willing to do.
And the documentation, what kind of documentation is provided? Same as if a patient would be seeing the physician in person?
Absolutely. In fact, we don't have time constraints on our patients because we don't have a lot of other patients, right? This is what we do. We have plenty of time, so there's no rush. So oftentimes our documentation is even longer and I think more thorough than what's standard in office.
And Dr. Pirie, this one's for you. Over the years, I'm sure you've made arrangements or attempted to make arrangements for clients to see, or patients that is, to see psychologists, yet finding somebody who's available on the calendar or is conveniently located has probably been difficult. How does this fit in terms of your expectation for compliance and then eventual recovery from physical injuries by having a company like this?
Well, to answer your question, it's very difficult. Our clinics, we've got multiple locations spread out across a city like Chicago that, pre-COVID was not easy to get around in. There's a lot of traffic congestion. So having this type of service available, I think we're 100% compliant. and having NHF, handle the scheduling and getting the appointment set is another thing that, takes burden off my staff and allows the patient to get these services done in a timely fashion. The reporting to follow up on that is excellent. So yeah, it's been great.
So you're just one provider. I mean, there are thousands of providers across this country that see patients following auto accidents and other injuries. I mean, this service is available by and through NHF and Cogent for everyone.
Yes, I mean, anyone that I think that's sort of this piece is to teach people to look for it. A lot of these providers are probably overlooking the symptoms, and then don't even realize that a service like this is available. So yes, absolutely available for anyone.
And Dr. Patel, how does the word get spread that, hey, listen, Cogent and NHF are available for providing this type of care? And does necessarily a physician have to be part of the NHF network in order to open up avenues for this type of treatment?
Good questions, Dave. First answer is we have to spread the word, right? We have to educate people on what's out there and what we can do for them. But secondly, I think that I don't think that it requires physicians, to be honest with you. I don't think it requires anyone with a lot of medical expertise at all. In my estimation, if someone has had an injury significant enough to cause physical harm to where it's affecting their life, can't go to work, they can't drive, whatever it happens to be, they've sustained a mental injury as well. They're always hand in hand. So anyone who has a physical injury, I believe, should be evaluated at least for the diagnostic part of this. I'll tell you a quick story. I won't take too long, but when my brother was 16 years old, he flipped my Mustang 4 times. With 4 kids in the car, they all got out without any physical injuries, but he didn't drive over 60 miles an hour for about a year and a half. We're a medical family, and none of us thought anything of it. There is treatment. He should have been better in 8 weeks, 12 weeks, like we've seen with our program. But unfortunately, there wasn't an emphasis on mental health at that point. We're starting to see that. And that's why we're here. We want to help as many people as we can.
So what does the medical literature say about physical recovery when psychological care is provided or intervention is provided right from the get-go?
Well, there's an abundance of literature that substantiates that patients with a psychological provider addressing those issues and injuries, they have much better outcomes. They get back to work quicker. They get back to their personalities quicker. It's amazing to see how, when you're just seeing a person in a cross-section of time, you don't know who they were before the injury. But they could have been a completely different person. Family knows it, and they see it. And we've had a lot of reports of family members saying, so-and-so, it's nice to have grandpa, it's nice to have this person, because they really do change mentally.
And Dr. Pirie, it sounds like Dr. Patel is suggesting that, hey, it doesn't matter where this referral comes from, whether it be from the treating physician, whether it be from the attorney. What's your thought in that regard?
I 100% agree. I mean, I think a lot of times, and you would know this with 30-year experience, sometimes the patients or clients will call and moan or complain to you. And I think sometimes with the providers, we're forced to see an abundance of patients now as the cuts come through. So the attorneys may pick up on symptoms that, again, like Dr. Patel said, that the family's picking up on, the kids are picking up on, they're missing work. So I think there's absolutely a teamwork involved in identifying certain things that can slip under the radar. So, anybody should be looking for this.
Yeah, and let me share a thought in that regard. I'll tell you, over the years, we have clients that call in and they want to discuss everything that's going on in their lives, and they're looking for a cathartic feel following the call. They're looking to us to really be the therapist following this injury. I'm assuming that you'd rather, Dr. Patel, you guys be the focus of those calls and be the feedback and treatment provider for them rather than the attorney.
Absolutely, and I see this in my own chronic pain practice as well. The patients, they need someone to talk to about a lot of this stuff, and I do the same thing. I refer them to a psychologist or a therapist, and those people are better at that than I am, and they have more time to do it, honestly. So I think it's very important.
And what happens if this particular patient who's got these psychological issues stemming from this injury, whether it be concussion or otherwise, what happens if it goes unaddressed?
Well, at the end of the day, I'll jump in here, Dr. Pirie, if you don't mind.
No problem.
At the end of the day, it's very possible that the patient will go back to quote unquote their pre-morbid state. But the question is how long, and those days are very important, right? Opportunity cost of a 6-month injury versus something that should take 12 months to treat. That's very big. And in some cases, we know patients never go back to normal.
And Dr. Pirie, what's your feel?
I feel the same way. I think one of the things that I've noticed in treating car accidents is that certain symptoms, especially headaches, are probably, minus the real catastrophic injuries where there's, fusions or, multiple surgeries or things like that. In a lot of these cases that are almost dismissed, headaches seem to be one of the underlying conditions that will continually come back. So they may be symptom-free for 3 months or 6 months, and then there's a trigger, and it always relates back to that one event 3 years ago, 5 years ago, 7 years ago that seems to have triggered it all. So I think that was probably from the lack of availability 8, 10, 12, 15 years ago of having something like Cogent. But I do see that with a lot of people that I see, that the onset was this traumatic event. And at the time of this event, the person has a lot of things going on, right? They're worried about getting to work. They're worried about fixing their car. They're worried about picking up their kids from school. So there's a lot of stress that adds to that. And I think that might be disregarded when there is a true, mental component that sticks around after those things get fixed and things start to normalize. They just don't get back to their normal life without some type of help.
Yeah, I think back years ago where the standard approach following an auto accident was the client went to a chiropractor and treated within the confines of the 4 walls, and that was it. And then it started to transition where, okay, let's get the ortho and the neuro and the other specialists involved to address those other needs. It sounds like this is the last piece of the puzzle that really the attorneys, the patients, and all the providers need, and that is addressing the psychological, the neuropsychological injuries that might have been sustained in a collision.
That's one of the things that I've always loved with NHF is that they're always looking to help the patients, whether it be with plastic surgeons on burns through airbag deployment or networks of providers that we can refer to, pain, orthopods, spine. And then now with this Cogent, it's just another piece of the pie that I agree was missing and is probably one of the most, if not, the most important brain injuries versus, softer hard tissue injuries are probably going to cause longer damage and be more significant. If you look at NHL and NFL, the amounts that they paid out with those injuries, and some of them were single concussion injuries. So yeah, I do think it's very, very important to diagnose and get the specialists, like Dr. Patel said, that know what they're doing involved in the care.
And Dr. Patel, this telemedicine platform that you put together, this is something that predated COVID. It's kind of coincidental that now we see a big push for telemedicine in all aspects of medicine. Why'd you put it together, and tell me how it's going.
Sure. Well, like you said, we started before COVID. And as I mentioned before, there are some times where you physically need to be with a physician or a provider, but there are other times where you don't. If you're not putting your hands on the patient, I don't feel there's a real necessity to be in the same room. I think you can get all the information. And if you can have a product that's just as good, or I think it's better because people are more comfortable at home. If you go to see a therapist, you got to talk to someone, you're in a foreign environment. How likely are you to be relaxed enough to really tell them everything you want to tell them? What we tried to do is try to make the patient as comfortable as possible, deliver everything to them. And at the beginning, there was some apprehension. It was a little bit tough. Some patients were a little bit worried about, talking to somebody through a computer screen. But if there is a silver lining to COVID, it's that everybody is much more comfortable with this now. Almost everybody has had a telemedicine appointment of some sort in the last 6 months. So what we're seeing is people are having a lot easier time getting on. It decreases the burden on our staff significantly because patients are familiar already.
And to draw this to a conclusion, how does NHF provide an advantage for, say, a treating specialist, an orthopedic, or maybe a neurologist? You know, how does NHF provide benefit to them? And, you know, why would you encourage a specialty provider to become involved with NHF?
From my point of view, I mean, the specialty providers, I think, a little bit shy away from sometimes treating the personal injury patients. And that isn't because they don't want to treat them. I think a lot of that comes from a little bit of knowledge. You know, in Illinois, for example, with the Lien Act being 40% of the total settlement, you know, but there's $100,000 or a $25,000 or $1 million policy. I think providers sometimes get a little bit intimidated with the numbers, so therefore shy away from it. Involving, you know, NHF, I think, allows the providers to just do their job. They get the referrals. They don't have to worry about filing liens, certified mailing liens, you know, calling up to see status. They don't have to worry about waiting on liens. You know, that's another thing. I don't think that working hypothetically for free is a real smart business model. So getting paid out on these cases and letting NHF and their people chase down the claim, I think, is an advantage. And it as everything gets cut, you know, I saw the other day that Medicare is actually a 9% cut on physical therapists, 5% cut on other services. I mean, at the end of the day, you know, everybody spends years and years and years going to school and thousands of dollars, you know, putting themselves through school, and the squeeze on commercial payers and federal payers is just crazy. So this is, patients need their help, and versus shying away from it and not taking it just because they don't know. I think that's another thing that NHF offers, is that with knowledge, we can actually open up these personal injury patients for these providers. And I think that's very important going forward if they wish to stay in any type of private practice outside of a hospital system.
Dr. Patel, I saw you shaking your head and anxious to confirm those comments from Dr. Pirie. What do you have to say?
Absolutely. I think there's a couple parts of it. One is just the personal injury side. Relative to what we do for patients, I think navigating insurances is the hardest part of my job. Everything has a different rule. Every company has a different requirement. Payment is a nightmare. And then if you do get paid, sometimes they'll just come back and say, no, I want that back, and you have to give it back to them. So moving an office is so difficult with any sort of commercial insurance payers, with Medicare, the address changes, all that stuff is so difficult. You can't really spend time treating the patient like you should. So on the personal injury side of things, you don't have all those obstacles in order just to treat the patient. In terms of NHF, the network is great. You know, first of all, you have like-minded physicians trying to do the right thing for patients who, you know, have an injury. They're no different than a person who has an injury that has commercial insurance or Medicare, but they're lopped into this different pool because it's just a different sector, sort of. So having that network to be able to refer back and forth specialists, like Dr. Pirie was saying, is so helpful. But on top of that, just the organization, you know, keeping all of the referrals and those things organized, getting approval for things, for procedures, and then most importantly, again, Dr. Pirie mentioned it a little bit, it's a single payer system. That's what we've been hoping for insurances for quite some time. You know, all our bills go to the same place. They take care of everything on the back end, which allows us, again, after 30 days or 45 days when those payments come in, we're allowed to move on to the next case and not have to worry for 6 months, 12 months, 2 years on what happened with, you know, Joe Smith, I saw 18 months.
Gentlemen, that was outstanding information for our audience. Is there anything else that you can think of that, hey, maybe you remembered relating to one of our earlier issues or topics? Now's the time to have a go at it.
I can't think of anything right now.
Dr. Patel?
I would just like to reiterate, as Dr. Pirie mentioned and we discussed kind of at length, is be proactive. You know, don't wait. You wouldn't wait on a leg injury. Why wait on a head injury or a mental health injury that you can't see? The testing that's done for the psychological evaluation is non-invasive. There's no radiation involved. There's no side effects to the treatment. It's very clean. There's really no risk. So if there's any concern, have a very, very high level of suspicion and just send the referral.
Yeah, and in closing, for our attorneys out there that might have to be listening in, you know, I can't stress enough the import of sending out your clients to appropriate providers, whether it be for physical treatment and or psychological. Don't be the psychological provider for your clients' care, but rather rely upon somebody who knows what they're doing. Appreciate you all. Thanks. Have a great day.
Thanks for having us. Thank you.